My name is ONOTAI. Um, I'm part of the class, so we're just going straight to business. We're going to discuss health policy as outlined in the lecture schedule. Okay? Can you hear me?
Yes, Prof.
Yes,
It's
sir.
okay.
Yes,
All
sir.
right.
Yes, Prof.
So it's going to be like a discussion and interactive section. Unfortunately, the class is so large. So, Ikena, you are going to take note of attendance. Well, the attendance will show on the Zoom. So, because we may
Sir.
like to award some marks for class attendance, participation, and all that. Okay. So, what we are going to start with is what health policy is all about. And I believe that all of you are from different background, and I want you to bring your wealth of experience. Please feel free to interact. Okay, I don't know how you do it. If you want to say something, am I the only one that Ikena? Can you know who you want to speak and all that, or by raising hand or what?
Okay, sir. They can indicate by raising their hand, then we can unmute them to
You
speak,
you
sir.
can you can you can do that. So you do that
I
with
can
me,
do that.
okay?
All
Okay,
right.
then please, before you talk, just give me your background, your name, your background. Background, like for instance, now let me start. My name is Professor Lucky Onotai. My background, I'm a surgeon, but I have bias for public health and the healthcare policy. So that's my background. So I'm not talking to you here now as a surgeon, but I'm talking to you as a healthcare policy maker. All right. So you just introduce yourself, at least we keep going. Then you talk. Let's see whether I have some. Then at the end, I would send the materials to the class captain, to help uh, give to the class. No, not this one. Uh, not this one. Let's see. Oh, can you see? Can you see what is my screen showing?
Yes, sir. Your screen is up, sir. Health
Okay,
policy
fine.
by ONOTAI. Yeah.
Yes. Okay, so let's go through it. Health policy has become increasingly prominent in the programs of most governments in the world. Now, issues and challenges associated with the health of the population and the organization and funding of its healthcare services are seldom out of media headlines. Now, people working in the fields of health and social care are tasked with responding to and implementing a stream of new policy initiatives, which do not always seem consistent or coherent. Okay, let's just go down a little. Trying to scroll it down. It's not okay, yeah, to respond now. Okay, now what's the aim of trying to understand what health policy is? What are we going to achieve, by actually discussing health policy? Now, it will critically examine health and healthcare policy issues. Okay, particularly, a minute. Okay. In particular, one, to enable us, you and I, we are the participants, to gain an understanding of the policy making process in health. So this is key. By the end of today's lecture, we should understand the policy making process. Now, we also enable the participants to apply new concepts to the experience of health, illness, and disability, okay, and to contemporary health policy issues. Then we can also explore policies and practices, especially those which cross the boundaries of health and social care services. Okay. Now, what's going to be the learning outcomes? Now, at the end of this, students will be able to, one, understand some of the processes by which health policy is made. Two, analyze policy dilemmas and discuss issues in health policy using a multidisciplinary approach. Then critically review policy and practice in health and related areas. Then students will also be able to distinguish between different stages of policy formation and relate them to the study of health policy. Now, we should also understand the role and influence of different actors in the health policy process, including patients, the public, and professionals. Well, during the lecture, we, that is participants, we take part in group and plenary discussions. Unfortunately, if we were to be in the classroom setting, this would suffice. Unfortunately, we are not. This is through Zoom. So we may not be able to do that. Okay, and we will not be able to work in groups. Okay, so now these are some suggested readings. Okay, and all that. So as let's go for introduction. That was just an overview. Let's see this one. No, not this one. Yeah, let me see the. 1 minute. I'm looking for. Okay, maybe it should be this one. Let's see. Okay, I think it should be this. It should be this one. Okay, you can see the slide, right? In the screen. Hello?
Yes, sir.
Okay, now, so as a part of introduction, because what we have in our schedule, introduction to health policy, okay? Now, the responsibility, we are using Nigeria as our case study, for instance. Now, whose responsibility in the Ministry of Health that is giving maybe the burden of formulating policies, or in Nigeria, which parastatal or which ministry is responsible for health policies? You can answer, this one doesn't need raising up your hand. As I pose a question, you can just respond. Which ministry? Ministry of Health, right? The Department of Health in the Federal Ministry of Health make sure people have the support, care, and treatment they need. So it is the responsibility of the Federal Ministry of Health to actually supervise the health system, the tertiary institutions, the secondary, and the primary. Anything that has to do with health is actually vested on the Federal Ministry of Health. Now, the healthcare system, we all know, helps people to lead healthier lives, recover well from illness, and live better for longer. So it is actually the Ministry of Health that does all these things. But in terms of, let's say, in the federal system, we talk of Federal Ministry of Health. Now, in the state, then you have the State Ministry of Health. Then in the local government, which aspect of the local government that is given the power to make policies in the local government? I need response from the class.
It's
Primary
primary
Health Care
healthcare, sir.
Management Board.
What?
Primary healthcare.
Primary health care management board is still at the state level. I'm not talking of local government. In the local government.
We have in the local government, we have the budget and planning and finance. Budget and planning and finance.
In health.
Yes, under health, they have all the sub-departments under
Local
health.
government health authority.
That voice sounds familiar. Who has that voice? Well, you know, in local government structure, you have the Department of Health that is headed by the Secretary of Health. Or is that old nomenclature? Is it not in this dispensation?
They are called medical officers of health.
Yes, medical officers of health. Okay. All right. Now, yes, what is health policy? If you want to explain health policy now to a market woman to understand it, what will you say is health policy? In a simple way, just put it so that a market woman will understand. Okay, or what is policy?
Policy is just like a map, for achievement of a goal, isn't it?
Map, yes, a map. I like that word,
just,
map.
Just to show the way you're going to achieve what you've promised you're going to achieve, your responsibilities, just outlining the strategies and then on how you're going to get there.
How are you going to get there? How is it different from guidelines?
I think guidelines is just like a framework. Yeah, standard operating. So just like a framework that really that everybody within the government subscribes to, just your limits, or just to show you how you will do things, just like an SOP, like you said. Anyway.
Right. Okay. I think we all understand what we are saying. Now, health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Then health policy includes the actions or intended actions by public, private, and voluntary organizations that have an impact on health. Okay? Now, the term also includes political parties' policies that may be translated into government action at a later stage. Now, what I'm trying to say here is that we have, let's say, PDP and APC now in Nigeria. Okay, we are using Nigeria as a maybe example. During the campaign, maybe the PDP might say something that, look, we're going to do this, their program, their plan for health can be part of their manifesto, so the government or the political party can, try to say something about it, okay? So it can also include political parties' policies that are, related to health okay, which government will now try to like implement in the nearest future. So policy may refer either to a set of actions or decisions or to even statement of intent what will be done in the next 3 years. Okay? Now the policy making is a competitive process with the competing interests of different groups involved in shaping the direction that policy takes. This statement is pregnant, meaning that policy making is competitive. It's not just straightforward. There are going to be a lot of decision making, choice, a lot of factors that will come into play when one is considering formulating a policy. Now, policy results from a synthesis of power relationships, demographic trends, institutional agendas, even community ideologies, and economic, resources. Now, an explicit health policy can achieve several things. It defines a vision for the future, which in turn helps to establish targets and points of reference for the short and medium term. Now, policy outlines priorities and the expected roles of different groups, and it builds consensus and informs people. Now, I'll be talking about groups. I don't know whether when I talk about groups, do you understand the groups I'm talking about when we are talking about health policy, not just policy? Because if we're talking about public policy, we have it in different aspects. But we are now talking of health policy. Are there any group that comes to your mind that are key players? Class?
The community.
Okay.
The different
Community.
professional bodies.
Excellent. Excellent. The
Lawmakers.
different professional. Go ahead, he said.
Stakeholders.
Yeah, stakeholders. Can we list some of them? Can we list
Commissioner of Health.
Commissioner of Health? That one big go.
We have like the non-clinical personnel.
Yes, non-clinical personnel. Yes. What of the nurses? The lab
Those are the
scientists.
healthcare professionals.
Good. Now you now talk of the groups.
Patients.
The patient. You have JOSU, you have NAM, you have NMA, you have AROD, you have all these are groups within the healthcare sector.
PSN.
Oh, excellent. So these are groups that have interest. So when we talk of health actually, all health workers have to work as a team. The doctor, the nurse, the pharmacist, the lab scientist, everybody works as a team and come together to formulate policies that would improve the health of the population. But the most important person in the health sector, we have you are going to choose one for me, class. Listen. One of the following is the most important person in the health sector: the Minister of Health, the Commissioner of Health, the Medical Director, the nurses, the doctors, the lab scientists, the patient. Just choose one.
Patient.
The patient.
Good. So you know that the patient is your employer, Abi?
Yes.
Who is your employer?
The patient.
Patient, sir.
Because if there is no patient, there is no
The
hospital.
patient.
Yes.
Yes, sir.
Are you sure that is the
Yes.
case in Nigerian setting or in Ghana or in other African countries? Does the patient have a voice in Africa?
No, sir.
Unfortunately, they don't.
Not really. Not
They
really.
don't.
They don't.
Yes, the patient does.
The patient, no, what I mean is that the patient in Africa,
In some places.
which
They
country
don't.
in
Not
Africa?
They
really.
don't
Not
in Nigeria.
No,
really.
sir. They
Not
don't
Not
have a
really.
voice,
really.
sir.
Not really, sir.
Unfortunately,
They
they don't.
don't.
Partially.
Yeah,
I,
partially. These days,
Like
in
the lawyers
fact,
get
in
that.
Nigeria, the only sector where the patient may have a voice may be some private sector, health sector, and companies.
Yeah.
Yeah.
Very true,
Because I
sir.
remember when I was doing some work for LNG, the patient had a discussion, interaction with a doctor, I think an ophthalmologist, and because he does not like the way the ophthalmologist spoke to him, he just wrote an email straight to the medical director of that hospital that he doesn't want to see that doctor again. That anytime the doctor is on duty, he will not come to the hospital. And you know that they called the doctor and asked the doctor to stop coming. Will that happen in the government hospital?
Oh, as for
No,
that
sir.
one, no.
No, sir.
No,
No,
sir.
No, sir.
Gradually,
No
we
way.
are
Okay, it
getting there.
depends on the kind of
No, sir, it
hospital.
doesn't happen.
Never.
Government
Not in the
hospital.
It
It
will
hospital.
never
depends.
happen. EPTH in
No,
particular.
these days, the
What
human
do you
rights
mean?
lawyers are
UPTH
getting
is
up.
a five-star. UPTH is a five-star hospital. Oh. Don't you know that there is a premium service going on in UPTH? Are you not aware?
I'm aware, sir.
All right.
But why?
The overall program objective in Nigeria is to strengthen the country's national and sub-national policy, advocacy and governance for strategic, equitable and sustainable health programming. Now, to achieve this goal, health policy program engages Nigerian stakeholders to increase their capacity to advocate for greater financial and political support. Now, the policy-making process, what does it entail? Now, it is important to understand the policy development process so that as an advocate, you can plan the type of input that can have an impact on any policy. All right? Now, perhaps you have identified a need for a policy. Now, before you talk of any policy, there must be a need. And you want to advocate for it, you want to push for it. Your approach will be different. So that if you want to be involved in the formulation, adoption, implementation, or evaluation of the process. Now, let's go on. Now, when we are talking about policy, there are key stages that are involved in the policy making process. For example, you have to identify the problem. Now, let me just use a scenario. When there was that COVID, what's it called? Is it COVID-19 pandemic? There were a lot of strategies, policies, WHO was interested, the whole world and all that. There was a problem. So once you identify a problem, you must justify whether that problem you identify, does it have impact? Is it worth, bringing to limelight? Because there are a lot of competing, health challenges that needs to be addressed with limited resources. So you as a policymaker, it's not everything they bring to your table you look at. You must look at it very well. Is this a problem? What is the justification for this thing? If we want to, what are we going to gain, when we do this? Okay, so here it is acknowledged that public problems will only reach political agenda if they are converted into political issues. Now, this one is different. If, for instance, you want something to be discussed and you are close to Wike, you know, you go and tell him, FCT minister, please, oh, I want you 1 minute. Yeah. Are you outside? I'm coming. All right. Okay. So you go and meet Wike and lobby him that you want him to, you know, bring it to limelight. Let them, you know, your people are all APC, you know, and let him know that during the last election, if the 4 million votes came from your village or from your locality, then you can now use that way to lobby. Then such things can come up. Or something that everybody knows that is affecting everybody. Okay, so it's not too straightforward. Please give me 1 minute. Let me give a key to somebody. 1 minute.
Yes, sir.
Wow, I'm back. I'm back, class. All right, thank you for that. So you can use political connections to also bring uh, something to limelight, okay? Now, this usually occurs when an interest group demands government action on a problem or when there is public disagreement over ways in which a problem should be addressed. Now, when we come to the next phase, because we are talking of policy now, we are discussing the policy, the stages. Now, the first one I said is agenda setting, or you bring it to limelight, or you identify the problem. Okay, now, under the formation, this stage in which policies are created or changed. Policies are products of the political context. I always put that one because without that, you will not get the backing, you know, and the support. Okay. Now, it is useful to understand policy formation as a social and political process in order to conceptualize how policies are formulated. Now, the next stage has to do with adoption. Okay. Now, this stage is when the policy is enacted or brought into force, for example, by state or federal legislation. Okay, then if it's local government, then it has to do with the councillors. Now, new or changed public policies are often adopted by means of decision of the cabinet. We know that, okay? Now, implementation is also part of it. When you identify the problem, you bring the policy, talk about the actions and all that. Now, under implementation is when the actions and mechanisms whereby policies are brought into practice. That is where what is written in the legislation or the policy document is turned into reality. In this stage, the content of the policy and its impact on those affected may be modified or, you know, accepted. There's no, because not much you can do now at this stage because you are already going to talk of implementation. It has passed through some stages. Now, I want to say that in Africa, most of our policies are excellent policies, but where we fall short is implementation. Do you agree to that?
Yes.
Yes,
Yes, sir.
implementation is a problem. Now, then after implementation, you cannot just go to sleep as a policymaker. You have to analyze. You have to look at what they are implementing. You have to monitor it. Okay, so in analyzing this stage is the policy process where one needs to examine how, when, and where these policies are making their impact, or is the implementation process, is it actually achieving targets? Then you also evaluate, this evaluation is the final stage. Okay, it includes monitoring, you analyze, you criticize, and all that. You now have to see whether there are going to be modifications in case you have to improve on it, because it is during the implementation you will now see all the bottlenecks and all that. Now, intervention. He said it is appropriate to look at how to plan policy interventions. Now, when planning policy interventions, you can develop and follow your own framework, and all that. Okay. Now, note, if policies are the outcomes of choices that entities make to achieve their goals, then politics is the means to those ends. Do you agree to that statement?
Sir, please repeat.
If policies are the outcomes of choices that entities make to achieve their goals, then politics is the means to those ends. It is a statement of fact.
Yes, I agree.
Yes, you agree.
Yes. So
Yes,
the
I
product,
agree.
the
Yes,
product of
sir.
the two, policy and politics, is usually legislation and the budgetary process that is required to support implementation. So that is why I said in Nigeria, we have excellent ideas, policies are there, but when it comes to implementation and there is no budget for it, it has died a natural death at birth. Now, let's talk about interest groups. In our few minutes ago, we were talking about who are the stakeholders. Now, these interest groups involve themselves in the policy-making process. Like this class we are in now, we all have various backgrounds and we have various interests we are serving. Are there doctors in the class? Hello?
Yes,
Are
sir.
there medical doctors in the class?
Yes, sir.
Yes, sir.
Are there nurses in the class?
Yes, sir.
Yes,
So we are good. So now the interest of the
sir.
doctor, is it the same with the interest of the nurse?
No, sir.
Not really.
No,
No, it's
sir.
not.
Not really, sir.
No, yes, not. So you see what I'm trying to say. So when any
It will
policy
not
is,
be.
so some groups have more power than others because of their political position and their ability to influence the views represented in the mass media. Examples of some interest groups are NMA, ARD, JOSU. So there are so many. Now it is the politicians, the bureaucrats, and the powerful interest groups who set the agenda and decide the framework and philosophy of a policy. All right. So all this we are doing is just overview. So let's go to okay. You can still see my slide. We've discussed this.
Yes, sir.
We've defined what health policy is. Okay. These are still more definitions. Health policy is the collection of specific laws, programs, entitlements, regulations, administrative directions, and conditions of participation in various aspects of the healthcare system. Now, the term also includes political parties' policies. We've said that before. Now, We've mentioned this. Now, WHO 2011 says, and I quote, health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. So this will be our working definition. Policy results from synthesis of, we've mentioned this before. Okay, now, I think we've discussed this. Yes, let's go further. Yes, we have. Now, who are the actors in policy making process? We've mentioned it, but like as I said, what we are doing is overview. We're trying to introduce it. Now, number one there, if we use Nigeria as an example, a country, we talk of the Department of Health, then the politicians, the local provinces, where we talk of local government, city, municipalities, these are, actors, people within the community. Now, problems, you have health needs, demands. Now, within the community, you want to look at the problems they are having, or the health needs or demands. Then we now talk of the interest groups. Then we know what the interest groups are now. Then the external bodies. Can somebody give me an example of an external body as a principal actor?
Now rulers now.
The World Health Organization,
Yes.
UN
World
agencies, UN agencies,
UNICEF.
UNICEF.
Good.
UN
And
Civil
you
agencies.
said and all
societies.
of that.
Good.
Civil
What of
societies.
good? Then we also have institutions.
First mission.
All right, good. All right. So these are the actors, okay? Now, what is the role of the healthcare professionals? Now, healthcare professionals can actively take part in the general development of the values of the policy, the beliefs, the goals, the ethics, and social directions to build the initial groundswell of support for a particular course of action. Now, the healthcare professionals, which we are multidisciplinary, have to come out with research or prevalence, bring out things within the health sector that look, these are issues. For instance, infant mortality in a local government, we found out that it is very high. What is responsible? Let us formulate a policy to address the menace posed by infant mortality. Or there is teenage pregnancy, that is so prevalent in a particular community. You find out that in a year, maybe 40% of girls under 15 years old get pregnant. That is alarming. Or in a particular community, there is an outbreak of cholera. And if you are a healthcare worker, you want to find out why is there mortality from cholera in that community. You bring it up for discussion and you have to push for something to be done. Now, the role of the healthcare professional continue. They can provide data, research, and experience that can be used to develop ideas. They can also help shape the activities of organizations by taking part in public commentary and discussions. Now, let's look at a particular health system policy issue, for instance. Now, universal health insurance coverage. Is it not a problem in Africa, in Nigeria, for instance? Do we have universal health insurance?
No.
No.
We don't, okay? It's a problem. Now, if we want to take the US as a case study, now, when you are talking of identifying a problem for you to bring up for discussion for policy making, you must have a rationale. You must justify why it is important. Now, if we take this issue one, universal health insurance coverage, what about it? The issue is that there is not, the universal health insurance coverage is not enough, or maybe it's less in our country, for instance. Now, if you take the US, we say in the US, the size of the uninsured population increases annually, both in number and as a percentage of the population. It's already a problem. And remember, in US, the predominant healthcare funding is a private health insurance, unlike in the UK, which is a general taxation, or unlike in France, which is social health insurance. Now, if we come back home in Nigeria, what is the predominant healthcare funding system class?
Out of pocket.
Out of pocket payment.
Out of pocket pay.
Which is described as catastrophic.
Yes. Catastrophic. Out of pocket.
Now, another issue, if you want to reduce obesity and improve diet, you use the UK for example. They say in England, most people are overweight or obese. Now, this includes 61.9% of adults and 28% of children aged between 2 and 15 years. People who are overweight, you know too well, have a higher risk of getting type 2 diabetes, heart disease, and certain cancers. Excess weight can also make it more difficult for people to find and keep their work, and it can affect self-esteem and mental health. So this is an issue which one can look at if you look at a particular community or a country. But you cannot bring an issue without justifying it. I don't know, class, you understand the way I'm approaching it. You must justify why it is an issue. So you cannot make a policy without having data. Because why would you want to address obesity when hypertension is there, or maybe there is a malnutrition? So you must have data to know what choice to make. Now, an explicit health policy can achieve several things. It defines a vision for the future, which in turn helps to establish targets and points of reference. It outlines priorities and all that, okay? Now, the overall health program objective in Nigeria, for example, is to strengthen the country's national and subnational policy, okay? Advocacy, governance for strategic, equitable, and sustainable health programming. We all know all this stuff. Now, to achieve this goal, health policy programs will engage all stakeholders to increase their capacity to advocate for greater financial and political support. Now, the Department of Health makes sure that this is achieved. All right? Now, policy can be broad and visionary, set direction, express standards, be a concept or stated position or intended outcomes, be a statement of principle. Policies are distinct from procedures and guidelines. Okay, now let's examine this last statement. I'm saying here that policies are distinct from procedures and guidelines. Why did I say so? What is the difference between guidelines, procedures, and policy? Class. I'm waiting.
At least I would say policy is a legislation. It's been done via a legislative process. Whereas procedure, just like a means of achieving a thing. Probably want to perform a procedure in terms of surgery or procedure in terms of performing a lab test. Then guidelines, just like principles that is guiding the procedure.
Thank you very much. The guidelines and procedures are all part of policy. Policy has stages it has to go through. 5 key stages. And inside the policy in the stage 2, you have your guidelines there, your procedures there. In your stage 1, you bring it to the agenda and you identify what the problem is. Then the agenda setting, justification for it. Stage 2, you talk about how you are going to achieve that result. For instance, if mortality is 90%, in stage 2, you are going to talk of things, strategies, actions you will take that will bring down the statistics. Then you also talk of adoption. It has to be discussed with when you say legislature, it depends on the context. If it is the federal government, you talk about maybe the National Assembly. State, you talk about the House of Assembly. Maybe if it's an institution, you don't need to go that. It has to be the authority, maybe the management. Then if it is in a local government, the power, the legislature comes from the councillors. Then if it is just a community, it may be the council of chiefs. I hope you understand the flow. There must be some form of authority that will give it backing. All right? Ladies and gentlemen, these are the 5 key stages we have been discussing. Agenda setting, you have to identify the problem. Then the policy formulation, under the formulation, which is stage 2, that is where you state all your actions, everything you are going to do. Then under the adoption and legitimization is where you now subject all those things to the authority that is going to carry out the implementation and who has the right to endorse whatever you, the policymaker, and your team have put forward or put together. Then it does not end there. How do you implement? We have theories of implementation. But under implementation, we have 2 that is very common, and I know you know too well. They must have taught you. You've heard of top-down and bottom-up approach. Have you heard of that, class?
Yes, sir.
Yes, sir.
Train?
Yes,
You
sir.
heard of top-down and bottom-up?
Yes, sir.
Yes, please.
What is top-down approach? Can you give an example?
Information.
The federal level to grassroots decision making and implementation.
Simply put, it is authoritative from up down. For instance, let's say in a hospital setting, the CMD brings down on the neck of everybody. Look, this is what you must do. The input is not from the bureaucrat. It's not from the maybe those the policies are affecting. It's from up. Do this, do that, do this, do that. You have to, it's from up. They're enforcing it. But when you talk about bottom-up approach, it's the street bureaucrats, the commoners. Those people are actually the one that can actually implement it effectively. But I want to let you know that not all policies can be implemented with the same model. Let's say, for example, immunization, under 5 immunization is compulsory. If any child under 5 is not immunized, you may not be eligible to go to school. In some countries, they might say before a child starts school, you must show your immunization certificate. Now, such implementation strategy, is it bottom up or top down?
Top down.
Top down. Now, then, if you now look at this another one now, like for instance, they said HIV is pandemic in a community. A top-down approach will not work. It has to be a bottom-up approach. You must educate the community because when they are committing the act, the government is not there. The executive is not there. Even if you say you must use protection, the man is in the room with his wife or with his spouse, he decides to do anything. So it is when the end users actually understand the concept and they drive the process, making sure that, I need to get my protection. The government can provide it, wearing it. The government will not be there to enforce the usage. So such policies that you think the end user will have to drive it is better implemented with a bottom-up what? Approach. I don't know that I'm making myself clear.
Yes, sir.
Yes, sir.
Yes,
Yes,
you
ma'am.
are.
Now, under problem identification through agenda setting, please, if I'm too fast, let me know. And if you did not understand any concept I have introduced, let me know. I'll be very happy to go back. Now, stage one, problem identification and agenda setting. Now, policy problems are defined and the policy agenda set. Here it is acknowledged that public problems will only reach the political agenda if they are converted into political issues or you try to bring them up. That is true. Also, you can also shout, go to the media and say, look, oh, our people are dying of malaria. It will now reach the government and government will do something about it. This usually occurs when an interest group demands government action. Just imagine if all the nurses in Nigeria decide to march to government house and say enough is enough. Our mothers are dying from childbirth. Government must do something about it. Please let a cesarean section, antenatal care be made free in Nigeria. If all the nurses come together and push for that, do you think the government will listen or they will not listen?
The government will
They may listen.
Listen. They will likely listen.
sure.
Yes. So that is what I'm trying to say. So the problem identification is key. This usually occurs when an interest group demands government action. Okay? Then if the doctors, their way, they can easily say we are going on strike. But I cannot remember any time doctors have gone on strike or nurses have gone on strike or lab scientists have gone on strike in Nigeria because of the patient. If there is, please, somebody should remind me. Some of the strikes are ego related. Am I correct? Sorry, I know I
Yes,
have
sir.
practiced
You are
internationally
very correct, sir.
and I studied
Yeah, very correct, sir.
internationally too. Am I correct?
Yes, sir. You are
Yeah,
very
Yes,
please,
sir.
correct.
you are right.
Yes, sir.
Okay.
You're right. Too. Selfish.
It's only on their
Very
interest
correct,
that
Prof.
they go on strike.
Selfish interest.
Okay, and I know you are not going to be that type
It's
of
No,
all
it's not
ego
selfish
matter.
interest. It's not
huh?
selfish interest.
I don't think most of the strike is for is for the patient. I don't think so. Just for instance, now ASU is going on strike. I don't think it's for the students. Is it for the student? I'm an ASU
No, sir.
member. Eh?
No,
No, sir.
no, no, sir. It's
The,
not the
the student
student.
interest
It's
is
for the staff welfare
represented.
now.
For the lecturers welfare.
Even
I think it's I
Somehow,
think
sir, it's also
it's
for the
all of
students.
them.
even for the health strike, sometimes better infrastructure is a component of the strike, sir. So
Let me
eventually,
ask you a question. Has ASU gone on strike because students fail exam?
no way.
Like the number of students that are
Lie, lie.
failing. Uh,
No.
Yeah, but I don't think that takes away from why they go on strike.
But a
I
satisfied
think
lecturer will produce satisfied students, good students. So when the lecturers are satisfied, they will produce intelligent students.
well, the point I'm trying to say is that we have a peculiar situation in Africa because the public servant is poorly paid. So most of the agitations has to do with survival, how to survive first, okay? That is the truth. That is the truth. But as head policy makers, when you go to the field, wherever you find yourself, the patient, the community comes first. Okay? So bear that in mind.
So I have a
I
question.
think that it will not always work like that, sir, because it's okay.
Yes, go ahead.
It will not always work like that because everybody would still, at some level, require some level of selfishness to actually sustain the system. So if you, who is the policy maker, you are not, your own
We're
needs are
taken
not
care of.
met, it's
If you are
difficult
not
for you
happy,
to actually take care of other people's needs.
I agree with you.
Yeah, so that's also
So,
at the very basic level. Yeah.
all right. So we pray for government to live up to expectation.
There's also the need that we may all be patient one day. In one time or the other, we may all become patient.
But
So
don't
we have
care.
to.
They will fly. You don't have an MRI machine that is functional in the government hospital, but they will go to private. Is it? So that is in Africa, but we are not. This class is global, so we are not actually preparing you for Africa. That's why we are just taking it this way. Okay, all right. Because some of these problems we are having are not.
They are not
Not.
like that
In fact,
everywhere.
as I'm talking to you, I'm privileged to be in a country where primary health care, secondary health care, tertiary, even to fly you to America by doing Medivac is free.
Good.
Throughout medicine, investigation, feeding is free.
Good.
As I'm talking to you, free. If you need a heart transplant, it will be done free at the expense of the government.
It's out of this world.
Can I
what country is that?
Why you want to go to the country?
I'm interested.
Out of this world.
Leaders are not ready for that.
So I'm just telling you that, okay? And I'm also aware that at a country where they keep sending me messages, come and do this. You are supposed to do this blood test. You are supposed to do this one. Free. And if I miss the appointment, they will still remind me. In fact, it become an issue, so they're not going to leave me alone. Must I come and run the test?
So
Free
the
of charge.
question I have a few questions.
Let's leave that. Let's move forward, okay?
I have a since
Yes,
can,
go
can
ahead.
I yeah.
Go ahead.
So since this is a policy class,
Yeah.
I wonder if the conversation, because from my understanding, apathy is not like complacency. The reason I
Yes.
feel like the citizens or the ASU people react the way they do is not just selfish interest, it's not just stuff that I feel like what we're discussing is more reductive in the sense that the bigger issue here is that there isn't a system. The reason why in the country you're being called and all of that is there's a system that rewards a behavior like that. That's not the same.
Excellent, yes.
That's not the same in Nigeria. So when people
That is it.
I wonder what we as, because we're in this class so we can make the health systems better. So I wonder what we can learn by understanding this problem and what solutions we can put in place to ensure that Nigeria's system becomes a system like that instead of just
Good. Now
reducing
we'll
like
get to
selfish
it.
reasons and
Good. We'll
whatnot.
get to it when it comes to implementation and budgeting and funding. So we are on track. Okay. When we start to formulate the policy, we go to the various stages. Then where the challenges are, we will now look at it and see how other countries have overcome such challenges. Are we together?
Yes, sir.
All right. Now, when it comes to this stage 2, this stage in which policies are created I think we've mentioned this one before. But under this stage, please, I don't want you to confuse this stage. When you talk about policy formulation, under this stage, this is where you outline your strategies. For example, stage 1, we said there is obesity, increased prevalence of obesity, which is the problem. Now, under formulation here, this stage 2, you now say, what are the things that can be done to reduce the prevalence? 1, lifestyle changes. 2, eat right. 3, let there be display of all calories on food or something, like that. There's going to be public enlightenment campaign. There's going to be like maybe in all government offices on Fridays, let there be 2 hours of maybe physical activity. 6, let there be maybe school children, or maybe if it is at work, let the government maybe provide lunch, healthy lunch or something. These ones, all these things are strategies and actions you are bringing out. This is on this stage. I don't know that you understand. Where you bring out the things that can be done to address the challenge is under the stage 2. Now, then the next stage is this legitimization. When the policy is brought into force, for example, you have to present, if it is the federal government, you must present it. If it is state, you present it, local government. So it has to be adopted by the authority. Yes, we agree on these strategies you are saying which you use to address this issue. We endorse it. Okay? And it now comes to the next stage. This policy, you that is a policy maker, you ask yourself, is it better going to be implemented by a top-down approach or a bottom-up approach? You also state it in the policy document. Advise which strategy. And when you talk of implementation, you must already know that you know the budget. Is this something that is going to need a lot of resources, a lot of manpower? Are the manpower there? Not bringing out ideas that you know that will not work. You must make sure that whatever you are putting together is doable. If there is no funding for it, for instance, you want to prevent cholera in a community and there's no money to sink a borehole or to get potable drinking water, the community people defecate in the river, they bathe in the river, they wash their clothes in the river and also fetch their drinking water from the river. And you are talking of a policy that will address cholera in that community. It will not work. If you now design that, yes, there's going to be no use of pit latrine, or you want a water system latrine, you want to give them pipe-borne water, where's the budget? So you must balance all this. Then when the implementation has started, you don't go to sleep. That is where you now start talking of monitoring, evaluating it, analyzing, and giving feedback. Now, let's see some caution. Caution concerning implementation, especially at the community level. You have to feel the impulse of a community when dealing at that level. You take the pulse of the community of interest to understand what citizens will support. Don't go to a community that don't believe in a particular concept and you want to force it down their throat. It will not work. What the community will resist, don't put it before them. You will have a far greater chance of success if you set out to implement policies in ways the community will support or at least tolerate, than if you challenge their basic belief during implementation. It will not work. Do you understand what I'm saying, class?
Sir, please
Very
come
well,
again.
sir. Very well, sir.
Okay, is there anybody who did not get what I just said?
Sir, please, can you come again? Network disrupts me from getting the last statement.
I'm saying caution. When it comes to implementation, you have to be very careful, especially at the community level. You cannot just bring out something and you think it will be supported by the community without feeling the pulse of the community, without knowing their beliefs. Okay? So you must take the pulse of the community before you now suggest ways of carrying out some implementation methods. Now you will have a far greater chance of success if you set out to implement policies in ways the community will support you than if you challenge their basic belief. Okay? Then you also need to assess, monitor, and evaluate. Now, this is the final stage in policy making process. It includes monitoring, analysis, criticism, and assessment of what is going on. Okay. Now, this covers the appraisal of their contents. You must critically appraise whatever that is already ongoing. Now, if you remember during that COVID-19, there are a lot of evaluation was taking place from the is it CDC. You get updates this week. So number of cases. This is what is happening. Such things need to be evaluated to see whether your strategies are working. I hope you understand. As a policymaker, you don't go to sleep when the document has been passed. You must still be on the field looking at the impact of what the policy is making. You have to analyze, and for you to do analysis, you have different levels. You have your micro, your macro analysis, and all that. And you must actually still do a bit of survey. Okay? And based on that, policies can be improved upon subsequently. Oh. Okay? Now, in conclusion, the stages of policy making do not just often overlap, they are often inseparable. Now, when I mentioned the 5 distinct stages, it's not like as if they are just following each other like that. There's an interplay. You just have to overlap them. Now, in the real world, policy problems and policy solutions frequently emerge together rather than one after another. In other words, plans may be present at the same time or before, or a need to act has been identified. So what I'm trying to say is that I made it so simple that we look at it one after the other. But in actual sense, it's an interplay of all these stages that need to come together for you to say you have actually formulated your policy. Stage 1, stage 2, stage 3, 4, and 5. Okay? All of them has to be put together. So that is why you see that it is not just a guideline when you talk of policy making. Guidelines are part of it. Procedures are part of it. Okay? But in this, our schedule, they were asked to differentiate between policy and law. Now, I want to emphasize that the implementation process is not the end of policy making, but a continuation of policy making by other means. When policy is pronounced, the implementation process begins. Okay? So now, what is law? Can somebody tell us, class?
Law is an act of parliament.
Are you a lawyer? Because that answer is so direct.
I'm not a lawyer.
Yes. Yes, but you're correct. It's an act of parliament. So what's the difference between policy and law? Are they the same or they are different?
They're
No,
different.
sir.
They are different.
They are
They are
different.
different, sir.
Yeah.
So what is the difference?
Sir, law, when you fail to abide by the law, it is punishable. It's a punishable.
Do you have anything that can use to clean?
But
Okay.
but policy doesn't have to do with punishable act.
Yeah. So,
Hmm?
like the first speaker said, it's an act of parliament. Law is enacted, and there are stages, that documents will pass before it becomes a law. I mean, not so.
Yes, it
It's
is.
true, sir.
Yes, sir.
Now, let's look at some key concepts. What is the purpose of policy? Now, policy is a deliberate system of guidelines to guide decisions and achieve rational outcomes. A policy is a statement of intent and is implemented as a procedure or protocol. We've had a lecture on that, so I'm just looking at this. Now, policy is a structured set of rules and principles created by organizations. It could be individual, private organizations. It can even be a local government, it could be a state, it could be federal, it could even be global to guide action and shape decisions. It defines what is acceptable, what goals must be achieved, and what standards people must meet. Now, but when you talk of law, a law is a rule or set of rules established by a governing authority, such as a government, to regulate behavior and maintain order within a
Nah.
society. This is to simplify it. These rules are typically written and enforced by the state with consequences for those who violate them. So laws provide a framework for a peaceful society by defining acceptable conduct and establishing mechanism for resolving disputes. So law is on the extreme. Okay? But policies are set of guidelines, rules, regulations that are being put in place to enhance the quality of care in society. Now, law is a system formally enacted, okay? We've discussed that one. It is not a guidance, it is mandatory. In law, it is mandatory, and compliance is demanded through official enforcement. Laws are passed by legislatures, interpreted by courts, and enforced by agencies like the police. Okay? Now, key characteristics of law includes it's enacted through legislative processes, legally binding, uniformly applied to all members. Nobody is immune to the law. Okay, backed by penalties for non-compliance, designed to enjoy justice and order. Now, what is the relationship between policy and law? The relationship is cyclical. Policies shape laws, and laws drive policy development. So it is interrelated, okay? Policy and law are different in scope, strength, and authority, but they work best when they are aligned. Policy sets directions, adapts to new challenges, and reflects the values of the institution or government, while the law provides stability, creates enforcement standards, and guarantee protection of rights. Together, they form the backbone of governance. Policy moves ideas into practice. The law ensures those ideas are carried out fairly and consistently. When both are used in harmony, society can now, become better. Citizens are protected, and institutions are now well taken care of. Now, if I may ask class, do we have thriving institution in Nigeria? Let's look at the health sector. what can you say about it? How strong is the health sector institution in Nigeria or in Ghana or in Cameroon? Class? How is our health institution in terms of strength? How strong is it? How viable it is?
So can we rate it via percentage?
Say what? Can you
Okay,
do what?
hello,
Yes,
sir.
I'm
I
with
think
you.
our health, okay, I think our health institutions are kind of epileptic. I would use that word. Not
Epileptic,
so
meaning what?
strong.
Is it
And
convulsing or is it status epilepticus or which one?
status
Status
epileptic.
epileptic.
It's myopic, sir.
What I mean is
Our health system
strong.
It's
weak.
comatose.
That the health system is
Yeah,
weak. And
Why is it weak?
Because
the
there's
health system
underfunding and
is weak
inefficient resource use.
because sorry, okay, all right. So
Yeah,
I feel that
Poor.
the health our
Are we
health
poor?
system
Sorry, are we poor?
no, sir, we are not poor.
we are not
Human
poor.
resource, we are not poor.
Are not
Even in
poor, but the
material resource,
policies are
we are
not
not
working
poor.
in the country.
Intellectual
Why
resource, we are not poor.
why
Sir.
are they not working?
So sir,
Because
I
we are
think
not cultured. We are not
Corruption
cultured.
on the leaders now.
can we remove
Nigeria
porous
is
Because
data
of
poor.
so that we can
Funding,
All is poor in
poor
education.
funding and management.
Can we just allow Fatima to speak? Please,
Fatima,
everybody is just
please.
speaking.
if
Fatima,
we
please.
look, thank you, sir. So I feel that there's always been a disconnect between the policies that we make, the implementation, and consequences. If you look through history, especially immediately after the First Republic, where we had politicians who were more of leaders than they played politics. Now we have politicians who are more politicians than leaders, and they are insulated from the consequences of the policies they make, good or bad. How many of these politicians who make these policies actually, utilize services from the health institutions? Many of them don't even know where they are located physically. They just know where it is on the map. And as long as we do not have that, implementation of policies, especially around the evaluation and assessment and consequences of failure or successes, I believe we'll continue to have whatever degree of, epilepsy that the health policy is currently suffering.
If I understand your analysis, you are trying to let us know that the problem is corruption.
Long and short, sir.
Yes, it's corruption because first of all, does the budget for the health sector, does it get to the desired ministry or the end institution that's supposed to use it? The
No,
answer
No.
is no.
I think I slightly disagree that
Okay.
corruption is like
Yes, go ahead.
I don't think it's as simple as corruption. Because there are corruptions everywhere in the world. I think the fundamental issue in the Nigerian healthcare system being non-existent the way it is as a result of multiple factors, such as underfunding and inefficient resource use. And if you look at that, like
The
Nigeria
major problem
budgets
is
we
political
allocate
instability.
less than 15% or so to healthcare. So from every level of government, healthcare is not a priority. It's not something that has been put into law as something that should be prioritized. And then number two, you look at the shortage of healthcare workers and the brain drain. Most of the reason why most Nigerians are leaving to practice in different parts of the world is not necessarily because life is better, is as a result of the fact that Nigeria simply doesn't have a system to promote innovation, to promote proper practice of healthcare. And then you look at the inequality and geographical disparity that exists. There is no connection between federal, state, and local governments when it comes to how healthcare is coordinated. There are no laws that have been passed. I mean law, I don't mean policy suggestions. If you look at pre-colonial time till today, and then you look at all the high out-of-pocket cost and limited financial protection, yes, they keep bringing, every administration brings up shiny policies that doesn't get implemented from the local level to the state level to the national level. And then infrastructure, logistics, and supply chains, data. There is no robust medical
Lara.
system, EHR in Nigeria, that today I can go to a hospital in, say, Lagos, and then I go to Abuja and I just give my date of birth and name, and they can pull up all my records for all the medical practice,
Oh, you are making sense, my brother.
you know? And as a result of
Well,
all of this, it lays the
It's not
foundation
American.
for why there
It's not
is
in Nigeria.
no
There's some other country,
healthcare
eh?
system in
Wants
existence.
to go
And so I don't
anywhere
think
in
it's
anywhere in the
corruption.
country.
And
well,
Just give
that's
your
okay.
just a very
date of
small
birth.
symptom
Sorry,
of
Then the
Mute your
your
mic.
whole information, that folder is one place.
Okay,
You
let
are
me
going
come
to
in.
sorry.
get your record. Yeah,
Class,
yeah, yeah.
class, let
So
me come in. Thank you very
national health
much.
record.
Hello, thank you
That's
very
a
much
good
for
one.
your analysis. The
Yeah.
problem is multifactorial. It's a multi facet. The problem is so diverse that you can't actually hold one particular thing. But why I mention corruption first, I'm going to let you know that in as much as the budget is below what is expected, it's unfortunate that the system encourages corruption. Now, I am talking because I'm part of the leaders of the health institutions. At least I've had an office as this number 2 in the teaching hospital as a CMAC. Now, I'm also talking from experience and also from my, knowledge of other health systems, how it works globally. Because actually, my health policy and health system was an international one that I had to study healthcare system in some of the developed countries and all that. And I did mine in Birmingham, and by God's grace, at least I applied myself. Now, when the ministry, look at how it works. The ministry sends money to all maybe the tertiary hospitals, states, and maybe federal teaching hospitals and all that. Now that money, they will go and give it to, maybe they want to buy equipment. The ministry will contract the contractor, 20 billion given to the contractor. Because the person on top is interested, he has taken some percentage. He will not supervise the contractor. The contractor will go to maybe India or Pakistan and bring second-hand things and supply them as new. Somebody will okay it. You will see a situation where you have machines being provided and they never worked since they were installed. But the CMDs cannot do anything about it because the ministry has brought it. Then you see a building, they'll give it to a contractor. It will be substandard. They'll tell you this is 20 billion. You go there, the thing they'll hand it over is, So what I'm trying to say is that us is still a problem. The little resources, if we use it well, fine. Now, talking of electronic system, you'll be surprised that some hospitals don't have computers. In fact, we still carry files and paper. You see, you know, records is zero. So the problem is huge. But if you go to the ministry, you see all of them well structured and budgeted for. I'm telling you. They will tell you that you need an MRI or CT scan in National Hospital. They will say 50 billion. After 1 week, you don't break down. Why? Some of the parts will not even be complete. In fact, let's not go there. But we'll pray that if you do this in some other countries, you are gone.
So that's what I was saying. We actually
Try it
have
in China.
national
Don't
health.
try it in China. Or try it in some places. So the point I'm trying to say is that the problem is multifactorial. Yes, but we still have a problem in Nigeria. Even in Africa, where people think it's an opportunity when you get a job, you won't do it well. Yeah, okay, let's leave health and even look at our roads infrastructure.
Exactly, because it affects everything, not just
For
health.
example, look at the monorail. Amechi started in Port Harcourt. You went to Canada, you saw monorail and train flying in the air and all that. You want to do it, you know you will not finish it. The next government will come, will not continue with it. You see, what is driving this? Look at Greater Port Harcourt, abandoned. Look at this, look at this, look at that. So what I'm trying to say is that we still have a problem, actually, as us, because we don't have a system that addresses these things, that corrects it. There is no consequence. Implementation, we have fantastic ideas. The policies are there. We are going to look into history of health policy in Nigeria. Now, that's the next lecture. When were under colonial rule, was UCH not working, brothers and sisters?
Yes,
do you know that the king
well.
of Saudi Arabia, he comes to take treatment in UCH, University College Hospital, Ibadan? But go to UCH now, it's not a shadow of itself. We have Indians, white people, and all that. Even BMH, Braithwaite Memorial Hospital. If you look at in those days, things were working.
Now BMH where they born, not them, all of them.
So the point I'm trying to say is that we still have a lot to do in terms of implementation. That is where our problems are. For instance, okay, let me give you a scenario. I was in LNG working, and I went to the pharmacy one time. I told them that, look, I live in Uniport, and we are doing ACE Day, prevention of HIV and all that. Do you know that the pharmacy there gave me cartons of condoms that I should distribute free of charge.
Jesus.
You cannot prevent.
You want to blind me?
Yeah, so somebody will not blind you. Please. All right. Mute your mic. So now, when they gave me those things, I was telling them, these things are huge. They said, please take, that is company. Do you know that such things were also distributed in government hospitals? Nobody got it free. Now, when I took the mistake I made, when I took my own and I went to give it to the student leaders to distribute, when I followed up, they never gave anybody. I saw those things end up in pharmacy. They went to sell them. So tell me, who do us? So how is such a policy that is trying to reduce the scourge of HIV from society will work? It's only when you go to maybe private facilities, probably you go to their toilet, you see it there, you go to their hotels, they give you free. But when you come to the government setting, you will not see it. Even the government, in fact, during that time they do the PDF, some of the things they use in the hospital, you see them in Aba. I've gone to Aba one time to look for instrument to buy. I saw things they engraved government hospitals from Umuaya in the market there. How did it get there? So that is the system we are in. So implementation is a problem. So we'll focus on that and see how things can work. They give you money to implement something. Say, okay, go and provide borehole for a community. 20, you seek one and you keep 19. How will it work? So is it that the system, the policy is not good? The policy is good, but what of who are the people enforcing it? And you ask question, how many of us can ask our legislators, the community project, how much did they give to you? What are you doing with the money? They are not answerable to you. You cannot even reach them, or you don't even know what's going on. But they get money for the community to do health projects. Nothing. And nobody questions them. All right. Okay, so let's go back to overview of healthcare policy in Nigeria, starting from 1960. We'll also look at equity and health. After this, we'll close for today. Tomorrow we'll continue so that I don't, overstretch the class. Now, national health policy. The national health policy represents the collective will of the government and people of Nigeria to provide comprehensive healthcare system that is based on primary healthcare. Now, it describes the goals, structure, strategy, and policy direction of the healthcare delivery system. It also defines the roles and responsibilities of the 3 tiers of government. Now, let's look at the history. Public health services in Nigeria originated from the British Army Medical Services. It's common knowledge that our colonial masters are the British people. Now, with the integration of the British Army and the colonial government, during the colonial era, government offered to treat local civil servants and their relatives. Subsequently, the local population living close to government stations, colonial medical service provided free medical care to the army and colonial service officers and incidental services to the general population. Now, other sources of health services were through religious and private agencies, dispensaries, maternities, and hospitals. I don't think some of us were born that time. We were talking of dispensaries. When go to some hospitals, Catholic hospitals, Methodist hospitals, private agencies were actually promoting the healthcare system in Nigeria in those days. You are aware? You are Gen Z now. No old
Yes,
school in the
sir.
class. Eh?
Yes, we are aware.
Now, in 1946, the first attempt at planning ahead for the development of health services took place. This resulted in the 1946 to 1956, which is a 10-year plan for development and welfare. Proponents of these are mainly expatriates under the colonial rule. Okay, that was then. One thing I want to give it to advanced countries, they plan ahead. We also plan ahead in Africa, but it's just that I don't know how sustainable it is. And what are the indices to show that we are making progress? We all know of MDG. It has changed to what? What is it now?
SDGs.
SDG.
From MDG to SDG. So what's the difference? What are the indices? What are the markers, to show that this thing is working? Now let's talk of first, in those days we have what we call is it EPI, expanded program on immunization. What is it called now?
Immunization plus days.
Huh?
National Program on Immunization.
Yes. Good. So now, are we making progress? Are these vaccines, are they available? Your guess is as good as mine. We have countries that have vision 2030. Some vision 2035, already planning ahead. They know they are moving towards it, achieving it. But I don't know, like somebody said, our own is epileptic. We go forward, we go backward. You have statistics in the news which are not matching what is on ground. Now, the features of the 1946 10-year plan. It lacked integration, not meant to have any economic target. It was modest, so this one was not actually perfect. Then in 1960, the country gained independence. Health policies were expressed in national development plans or government decisions. And the first one was National Development Plan 1962 to 1968. Now, the second National Development Plan took place 1970 to 1974. This plan identified and aimed to correct deficiencies in the health services. Third, national development took place 1975 to 1980. And in this third plan, there was deliberate attempt to draw up a comprehensive national health policy. Okay? The third national development plan dealt with issues such as health, manpower development, provision of comprehensive healthcare services, disease control, efficient utilization of health resources, medical research, health planning and management. Then the fourth one, 1981 to 1985, establishment of a benchmark for population census through the activities of NPC. The focus of the plan was to decrease fertility rate through voluntary use of moderate contraceptive, increase formal education. Then the fifth one, 1987 to 1991, focused on primary health care and rehabilitation of secondary and tertiary institutions. This was hardly implemented before its replacement by the Perspective Plan, which is from 1986 to 1990. Subsequent plans were 3-year rolling, 1990 to 1998, following the introduction of SAP. I don't know if people remember SAP, Structural Adjustment Program, 1986.
Yes, sir.
When in 2003 to 2007, we have the National Economic Empowerment Development Strategy. Then in 2020 came Vision 2020, aimed at making Nigeria a fully developed economy by the year 2020. 2020 came. Did we get the desired results?
Abacha died. No.
And that was the end. Now, in 2016, the National Health Policy was revised for the attainment of universal health coverage, the unfinished agenda of the MDGs, and the new SDGs, emerging health issues, the provision of the National Health Act 2014. These are all transformation from one to another. Now let's look at the National Health Act, which came out from the NHIS. So how effective is NHIS? What is the percentage of coverage? Is there universal health coverage class?
No.
No, sir.
So are we making progress with NHA?
Yes.
No, sir.
It's just on
Not
paper.
really.
Huh?
No, sir.
It's just on paper, sir.
That's on paper. That's what I'm saying. Now, in 2017, we have the Economic Recovery and Growth Plan. In 2019 is the Nigeria Health Sector Roadmap that is guided by the President Health Sector Next Level. So the problem is when a new government comes, they jettison the old one. So there is no continuity. They keep changing the key players, which is sad. So what are the challenges to actualizing development plans and policies in Nigeria? What are the challenges? Why are these development plans, these policies are not yielding desired results? Comments?
Okay. All right. Good evening, sir. Good evening, class. So I think that given what we've discussed so far, one of the first challenge would be that we do not have a clear plan as a nation of where we are going to and what we hope to achieve. So most of the plans are dependent on government tenures, regimes, and individuals. So that is a very big problem, because if we have what we are chasing as a nation, which is an agreement from every part of the nation, anybody who comes into power will be forced to abide by it. So if we are not trying to achieve anything as a nation, one nation, which everybody is aware of, the executive, the legislature, and every part of government is aware, and the judiciary, if we are not aware that this is what we are chasing, because if a president comes in and says Vision 2050, and it is his idea, and is forcing it or is putting it on the nation, no matter how good his vision is. The fact that those in the House of Assembly are not in agreement with him, they will
It will
not
not
see
work.
reason to make laws to protect and guide that vision. At the end of the day, when he leaves office, another person
To
comes
die
and will start to
a
complain.
natural death.
Yes, so we don't have a ground framework. Most of the developed nations we see, everybody, let's use the US for example, anybody who comes into power knows that at the end of the day, whatever decisions you are making, whether
They have
internally
a
or
roadmap.
externally, you are protecting the nation as the United States of America. That is what everybody is working towards. So even if the president wants something and the legislature analyze it and knows that this is not in direction with what we want for this nation, they will attack the president. And they will not be sentimental about it because they know that this is in
But you
deviation from
know,
what we
in
want to achieve
Africa,
in the long term.
the president is autocratic, and whatever the
Yes,
president says on your
yes,
mandate,
so
we stand.
that is the second stage of our problem. You know, the previous issue we talked about relation to healthcare system. Most of the things that we have, both healthcare, education, and everything, is going to continue to fail because we don't even have a constitution. The constitution is not workable, is not standalone, it's not enforceable. People can break the law. If the highest person in the country can disobey the constitution and it does not have consequence, there is already a chain reaction that is set up and it's going to flow down to everybody. So if the person who makes the budget can decide to not channel the resources that is stated in the budget to the right ministry and decides to take a chunk of it to himself and it doesn't have consequence, there's a chain reaction that has started. That means that the minister can also take his own part and there is nothing that is going to happen. So everything falls apart because the constitution is not working. Once there is rule of law, once there is punishment for disobeying the law, every other thing falls in place. The difference between us and developed nation is that there is a consequence for breaking the law, and it does not matter who breaks the law. So I
So,
think this is at the basis of it. Then in addition to that
So,
continuity, we've talked about that already. So I will give room for others to speak.
yeah, so thank you,
So,
thank
sir,
you.
good evening,
I would
sir.
like to add to this, and using my experience when when we had the MDG then. Um, the first thing I want to take there is the issue of involvement of the final users when it comes to formulating policies. Carrying everybody along is very, very essential. We don't just push policies to people when the people are not ready for such changes. Uh, when we were on the MDG project then, there was 100% free healthcare for people, delivery, neonatal care, adult care, everybody in the community. And then I'm just going to take two of them. There's also the aspect of agri, where we give farm inputs and the fertilizers to the community. So what really happened was everything we're giving to them, some who were not even sick, but because of the fact that they know that everything they're going to get at the hospitals are free, some will just come and say that they want something, they want something, they want this, they want that. Now for the agri, we gave people fertilizers, and we noticed that people ended up selling off those items to others. So when you push policies to people, when you don't carry them along at the stage of formulation, it can have a very negative ripple effect on that. The second thing is we have to understand that Nigeria is a very diverse nation. You see, it's easy for us to talk down on Nigeria because of several policies. Nigeria is multicultural. What will work very and perfectly well in the northern Nigerian part may not even have a taste in the southern part of Nigeria.
yeah,
So
that's
when
why you must feel the pulse of your community. You must
absolutely
individualize whatever you are doing. The way you implement in the north will not be the same in the east and in the west because of cultural
absolutely.
differences.
Yeah, so if these are not taken into consideration, you just said everybody should do this. For instance, there are cultural beliefs. There are still highly indigenous population in Nigeria who do not believe in other things that are institutional apart from their traditions. So
Yeah.
that is something we need to do. In fact, that can, until we overcome this, no matter how beautiful the policies are. Yes, I understand what Ade has said. Sorry if I don't pronounce your name, but we have good policies in Nigeria. Implementation is also very important. But now, the tough thing I'm going to talk about is the issue of addressing poverty. When people are poor, even the most sensible thing that you present to them, they see it as an opportunity to make ends meet for
To
it.
make money.
That's
To make
true.
money from it. So when you push something like that to people who do not have their livelihood means, they will be thinking of what is the need for us? What is the need for us? What are we going to get from it? So that can
So
actually
when you want
hamper.
to build a hospital for a community, they will go and meet the contractor to give them something, or else they will stop the project.
Absolutely. Yeah. So the last thing I would like to talk about, sir, is the issue of implementation. Yes, we have the input, output. Most time, when it comes to implementation, we are mostly after the outcomes, saying that, okay, how many people did we train? How many people did we distribute this to? Not really the impact of whatever
Whether they
activities we
even
have
used
carried.
it or
Yeah. So if we need to clearly look into the issue of the implementation of it. We should not just focus on achieving what we have outlined that, okay, we want to give 50,000 people this, we want to give 30,000 people, and we keep chasing the numbers without looking at the effectiveness of whatever we have done to, bring it about the desired changes. Thank you very much. Over.
Yeah, fantastic.
Thank you.
I'm enjoying the comments on the platform. In fact, I've read through, and I'm happy that the class is following and the discussion is robust. I really appreciate. I'm dealing with professors in this class. I think I've learned so much from this interaction. So, still on this discussion, if we continue, the list will not be. In fact, there will be no time to
Please, I have a
overflow.
question.
You have a
Sir, please,
question?
yes, sir. Sir,
Yes.
please, where can we categorize the Abuja Declaration? Is it a policy or a law? Abuja Declaration.
It's not a law.
Eh?
You just said a declaration, so it's not a law. The law has to pass a lot of stages: first reading, second reading. A lot of things. It's all policies, and they're all geared towards improving the well-being of the nation. Okay. Like again, I want to tell you again. Policy can also be in form of an executive order. I hope you know.
Yeah. Yes, sir. Yes, sir.
Mm-hmm.
Yes.
And you can also have policy in your own household, in your nuclear
Yes, sir.
family. I hope you know.
Yes, sir.
So actually, time will not allow me actually go too much details, but I believe you understand the concept. Okay.
Yes, sir.
All right. So we still have equity, because I think we are ending tomorrow, right? I wanted to add Saturday, but it's like you people, I learned Saturday is not included. Or will you be able to volunteer Saturday to be added?
Yes, sir. Yes, sir.
Yes, sir.
No, sir. No, sir.
No,
Saturday,
sir.
we
No,
forget.
sir.
Saturday is
No,
not
sir.
included.
We
No,
have
sir.
lecture
Let it
from
down low.
Monday.
Let it down low, sir.
sir.
Is it?
No,
Down
no,
low,
sir.
sir. Let it
Friday,
down low.
Monday.
So on
No,
yes.
Please,
for
let's
head
allow
policy
No.
on
class
Friday
captain.
this week.
No,
Abeg.
sir. No
No.
Saturday, sir.
You people
No,
should hold
Saturday.
on, hold on, please. Hold on,
If there is
please.
no Saturday, that
Before
Hold
means
we
on
get
for
back
the
to
tomorrow.
you,
class rep.
I will talk with them, get back to you, sir.
Okay, because the volume of things to cover is much. So if you spare me Saturday, I'm very happy. But your exam must still hold at when it is time. And
Please, our
remember, this is not an undergraduate class.
No,
It's
sir.
a
No.
postgraduate
will
class.
get back to you, sir.
Okay, you'll get back to me. So I think let's look at
MPH people should carry HSM along when you are making these decisions, please.
Yes, please. Very important.
it will not take. These lectures are, as we discuss them, it makes it easier. Okay, now I want us to
So
look
Saturday,
at.
what time are we looking at Saturday?
Definitely, it is the time that you people decide. Your class will decide. Okay.
Okay. Let's agree on the group, then we'll get back.
So get back. I want us to say something about equity and health. Okay. So what's the difference between inequality and equity? Are they the same?
No,
I
sir.
think it's
No, sir.
equity is the distribution of materials, services, and needs according to the demand level of the consumer.
Okay.
While equity is a supply of services to the consumer according to his level of demand, not necessarily what he ought to be given, but according to his level, what he can afford. That is simple, one of the simple ways to put it, sir.
Okay. So when you talk of, if you have 100 million to give to a population of 10 people, and half of that population is wealthy, and the other half is poor. How will you distribute the 100 million in terms of equity?
In terms of equity,
Yes.
sir,
According to the needs of the people
According to
involved.
I think equity is
according to the needs, level of needs, the poor people need the money more than the rich people. So equity simply means giving the money to the people that are in need more
yes.
to the people that are in need.
Yes.
So the money is given to the more of the poor people than the rich persons.
Yes, because they are in need. They are more in need than the others.
Yes.
So if it is equity, that means you charge them equally, irrespective of their status,
that
irrespective
is
of how
equality. That is equality.
Yes, that
equality.
is equality. Yes,
Not equity.
irrespective of their need. And equity is in respect of their need.
Equality is giving everybody equally, despite who is having and who is not having. In equity is where we now considered the people that don't have above those that have.
Okay. Let me see if I can share. I'm trying to share one of my slides. That's 1 minute. I don't know if you are seeing this slide now. Are you seeing the equity slide?
Yes, sir, I can see it.
Okay. Now, equity simply means fairness or justice, absence of systematic disparity in health. Okay. For example, let's use Nigeria for example now. They want to build primary healthcare centers in all the states. And let's say there are 36 states, including FCT, and they want to give 36. If they give one to each state, is it an equity? Is it equity?
No, sir.
No. It's equality.
That is equality.
That is equality.
Yes.
Yes.
Okay. What is inequality? What is inequality?
when it is not shared equally, when there is disparity in the distribution of the
Where
resources.
you give more to some areas than the other, right?
Yes. Yes.
Okay.
And it's not necessarily based on needs or
In
needs.
inequity and inequality, are they the same?
No, sir.
No, sir.
No, sir.
Inequality
Yeah.
is a broader term meaning unequal or
Yes.
difference in size, whereas inequity is a more specific or moral term connoting a lack of fairness or injustice. So equity is an important concept in health. Okay? Now look at the diagram. Somebody should speak to this diagram, please.
In the diagram, Prof can see that for equality, they are trying to view the gain that is going on there. The taller, everybody were given the same thing, but not all of them has given the opportunity to view the match. Whereas for the equity, you can see that the one that is taller was not given any support. Then the one that is shorter was given a higher one to enable each of the three to view equally.
Which one is better in terms of health concept?
It's equity, sir.
Correct. So now, does this diagram explain it?
Yes, sir.
So if you are going to share the 100 million, the poor people will get more
Yes, sir.
than the rich people for equity. But for if it's equality, you give all of them the
Everybody.
same.
Yes.
So equity and health. Now, targeting women and children. For instance, you can look at equality. Maybe you are targeting women and children. Then targeting the vulnerable, you are looking at equity. Let's assuming you want to share something between women and children. You say, okay, let's give 50% to children, 50% to the women. But if you want to look at the vulnerable people in the society, you give more to the less privileged, just like it was illustrated in that diagram. Now, variations in healthcare access occurs across population, rural versus urban, low, medium, and high income countries. So there is unequal distribution of funds and services. Therefore, the need for health insurance scheme has to be put in place. And that's what informed Nigeria Social Health Insurance Scheme, which is the NHIS. Unfortunately, it is only for those who are employed by the government. I'm aware there is community health insurance scheme where that the community people can contribute, but how many communities are doing it and is it effective? So that still remains ineffective if you look at the percentage coverage. So the fourth method of healthcare financing is still what we are still using, which is out-of-pocket expenses, which is predominant in low-income countries. Unlike other countries where social health insurance scheme is working very well, like the France model, then also in the UK where they do the NHS, and that NHS is funded by general taxation and subcharge, where they have their gatekeepers and the cost of treatment is free at the primary level, sometimes even in the secondary level, and most times they say co-payments. It depends, especially when you are going for cosmetics and some other highly specialized treatment. Then back to Nigeria, at what point is healthcare free? Even in the health center, you might go, they say OS, immunization, no day. In fact, I had to I remember I had to buy the vaccine for my daughter when she was to have a immunization. And even some of them we have in the health centers, there was no cold chain, no light. So nobody even trusts the potency of those vaccines. So Now, there may also be discriminatory treatment or provision of services for groups with the same health needs. For instance, those that have access to COVID vaccine. I remember during that COVID time, they had to do prioritization. Some people were even hoarding it and giving it to VIPs. Social determinants of health, social economic status, education, fiscal environment, income, occupation, all these affect health equity and inequalities. So how can equity be assured in health class? Will you want to keep some for your family? If you are giving the anti-malaria, for instance, to go and distribute in your community, how many of you will tell me you will not keep some cartons in your house for your family? How
I
many
will
of you
not
would
keep
deliver?
cartons in
How
my
many
house.
of you would
Me, I
deliver?
will not keep it. Oh.
I will
How
not.
many of you will
I will
deliver
not
the
keep it.
exact? Okay, let's assume you are giving 100 million to disburse to the community.
Temptation.
I can share it.
So sir, therein lies our issues, because we tend to have strong people and weak institutions. As long as the morality of the individual is the only determinant for successful implementation, then that becomes a problem, because strong systems even help the individuals to be able to, align with, with the principles, with the law. So we should not create situations that offer temptations even to good people. It's been said that angels will become corrupt when they come to Nigeria.
Well, thank you for being honest. Charity, they say, begins at home. Not be so.
It's true, sir.
Class, I want to thank you people. I think we've done more than 2 hours, or about 2 hours.
More,
And
sir.
I think it's high time we stopped tonight. I want to thank every one of you. I like the robust discussion. Tomorrow class, we are going to do more practical. We are going to formulate policy tomorrow. We are going to actually look at using a topical issue to formulate a policy. And I'm going to do it for the class so that I will be used as a role model. The pattern, I'm going to do it so that you can use it to do others. Okay? Then we also, tomorrow, we're going to talk about decision-making process as well as the various stages. Maybe we'll discuss it in total. All right. Then implementation theories, we'll look at it. Our problem is implementation. If we finish tomorrow, tell us. That means we don't need Saturday. But let's see how far we can go. I'm sorry that the time given to me is limited and the volume of what we need to know is much. But I believe I've attempted to give us an overview and I've been able to try my best to explain it to every one of us. And I'm happy that the discussion was robust. If there is any question, please feel free to ask me. If there is clarification, feel free to ask. And if there is contribution or any omission on my part, please feel free to add it. Thank you very much.
Thank you, Prof.
Yeah.
For the lecture.
Thank you so much, Prof.
Thank you, Prof. God bless.
Thank you. All right.
Thank you, sir. God bless you.
All right. I hope I didn't stress you people too much.
No, sir.
No,
Thank you, sir.
We enjoyed your class.
Thank you so
Thank you,
very
Prof.
much.
I appreciate.
All right.
Good night.
All right. So see you people tomorrow. Same
Okay.
See
time.
you.
Okay. Good
All
night,
right.
Prof.
Bye.
Bye. Thank you.
Prof, you can